You're lying flat on a wooden table. 4 strangers are gripping your arms and legs, pinning you down so you can't thrash away. Someone pushes a rolled strip of leather between your teeth, and the man standing over you, blade already in hand, is giving you nothing for the pain. Nothing at all. This isn't a nightmare. For almost the entire history of surgery, this was simply what an operation looked like. Hard to imagine, isn't it? Today, if your appendix needs to come out, you're asleep before the first incision. You feel nothing until you wake up in recovery, groggy, already halfway healed. A nurse checks your pulse. You go home the same day, and you barely think about it again. That idea alone, that surgery shouldn't hurt, is barely 180 years old. Before that, for thousands of years, going under the knife meant staying fully, brutally awake for every second of it. So how did anyone survive that? And why did a surgeon's speed, of all things, end up being the difference between life and death? Picture the room first. In the early 1800s, surgery didn't happen behind a closed door. It happened in a surgical theater, an actual theater, with tiered wooden benches rising in a circle around a central pit. Sawdust was scattered across the floor to soak up the blood. Tickets sometimes were handed to curious members of the public. Students crowded the rails, craning forward to watch, pocket watches ready in their hands. Why would anyone want a front row seat to that? Patients waiting their turn in the next room could often hear everything through the wall. The instructions, the cutting, the screaming of whoever went in before them. One of the most famous men to ever stand in that pit was a Scottish surgeon named Robert Liston, a man they nicknamed the fastest knife in the West End. At a time when roughly 1 in 4 amputation patients died, Liston's own patients died at closer to 1 in 10. His secret wasn't a new drug. It wasn't a new technique either. It was raw speed. Liston could take off a leg above the knee in under 30 seconds, start to finish. Before he began, he'd turn to the students holding their pocket watches and call out, "Time me, gentlemen." Was that showmanship? Probably, at least partly. But every extra second under the knife meant more blood lost, more shock to the body, more raw pain to endure. A fast surgeon, in that world, was doing the kindest thing available to him. Speed wasn't recklessness. It was the only anesthetic anyone had. Not every patient ended up in a crowded theater, though. Some were operated on quietly, at home, surrounded by people who loved them. That's what happened to Frances Burney, an English novelist in Paris in 1811. For over a year, Burney had felt a small, hard lump growing in her breast. Her doctors finally agreed. It had to come out, or it would kill her. What would you have chosen? On the morning of the operation, she was given just 2 hours' notice, barely enough time to compose herself. Leading the team was Dominique Jean Larrey, Napoleon's own chief military surgeon, a man who had already amputated thousands of soldiers' limbs on the battlefield. Larrey and 6 other doctors gathered around her bed. No anesthetic was offered. Not even wine, to dull her senses a little. A thin cloth was laid over her face, so all she could see was shifting light and shadow through the fabric. Then the cutting began, straight down to the bone. Burney later described, in a private letter to her sister, the feeling of the blade scraping against her ribs. Still, she stayed almost entirely silent, moving only her eyes. The operation went on long enough that even Larry, a battlefield surgeon hardened by thousands of amputations, came away from it visibly shaken and pale. Burney lived for nearly 30 more years afterward. Her doctors had one simple word for what she'd shown them that day: courage. What else could you call it? Here's what's easy to miss. The surgeons of this era weren't careless or numb to what they were doing to people. Many of them were desperate for something, anything, that could dull the pain. They tried opium. They tried alcohol. Sometimes pouring enough into a patient to make him half unconscious before the first cut. But there was a cruel limit built into that approach. Enough opium or alcohol to actually kill surgical pain was often dangerously close to a fatal dose on its own. When drugs failed, hospitals fell back on brute practicality. strong assistants, sometimes called dressers, whose entire job was simply to hold a patient's body still, no matter how hard it fought back. Centuries earlier, medieval physicians had even experimented with something called a soporific sponge, a sponge soaked in opium and other plants, held under a patient's nose in hopes of knocking them out cold. It almost never worked reliably enough to trust with a real operation. So what was left to try? One Scottish surgeon working in colonial India, James Esdale, tried something stranger still. In the 1840s, Esdale began operating on patients while they were in a mesmeric trance, an early unproven version of what's now called hypnosis. By his own account, he performed hundreds of operations this way, and he reported that deaths after surgery dropped sharply, from roughly 1 in 2 down to about 1 in 20. Back in Britain, most of the medical establishment simply refused to believe him. It sounded too strange, too close to stage magic to be real medicine. And within just a few years, the debate stopped mattering. Something far more reliable was about to walk through the door. On October 16, 1846, in an operating theater at Massachusetts General Hospital, now nicknamed the Ether Dome, a dentist named William Morton had a patient named Gilbert Abbott breathe in vapor from a sponge soaked in sulfuric ether, a chemical that pulls the body down into a deep, temporary sleep. The surgeon, John Collins Warren, cut into a tumor on Abbott's neck while a room full of skeptical doctors watched closely, half expecting the whole thing to fail in front of them like every attempt before it. Abbott didn't scream. He didn't even flinch. When it was over, and Warren asked how he felt, Abbott said simply that he hadn't felt a thing. The room, by every account, went completely silent. You'd expect that single morning to have fixed everything, instantly and forever. It didn't. And this is the part almost nobody expects. Death rates from surgery didn't fall right away. If anything, some operations briefly grew riskier. Why would that be? Because pain had always been the limit. A surgeon who once had 30 seconds before a patient's agony became unbearable could now take his time, cut deeper, and attempt operations nobody would have dared try on a screaming, thrashing patient. But nobody yet understood that dirty hands and unwashed instruments were spreading deadly infection. Real antiseptic surgery, clean, germ-free technique introduced by Joseph Lister, was still almost 2 decades away. So for a strange stretch of medical history, patients felt far less pain and still weren't much safer. Comfort and survival turned out to be 2 completely different problems. Solving one didn't automatically solve the other. Think about that the next time you're sitting in a dentist's chair. The needle goes in. A small coldness spreads through your gum. It barely registers as anything worth mentioning. When was the last time pain like that even crossed your mind? Or think of it the next time someone you love goes in for a minor procedure and walks out that same afternoon, complaining only about the grogginess. Even childbirth, one of the oldest and most universal kinds of pain, now comes with the option of feeling almost nothing at all. That instant of simply not feeling what should hurt is a genuinely new privilege in the story of your species. Every person who ever needed surgery before you endured what you now barely notice. Your calm in that chair is the product of less than 2 centuries of trial, failure, and one quiet October morning in Boston. So picture it one more time. You're lying flat on a table. Someone leans over you, and this time, instead of a blade, they're holding a mask. They ask you to count backward from 10. You barely make it to 7. And when you open your eyes again, it's already over, and somehow, you never felt a thing at all.